So please do write these in the chat as you think of them, and then we can answer them at the end if it's possible to, or we can answer them when we distribute the slides out to everybody. So the allied health professions are the third largest clinical workforce in the health and care. And in the main, they are degree level professions. So it means that you need a degree to practice as one of these professions, and they are professionally autonomous practitioners. So, we kind of can support patients on our own and come up with therapy plans and assess patients and provide them with what they need. There are currently 14 registered titles for AHPs covering 15 specific roles. You'll notice on this slide that there are 16 professions. That's because in the UK, prosthetists and orthotists are dual registered as one profession. There may be some professions on here that you've never heard of. And if you're interested in a career in health and care and you don't know what yet, I would encourage you to have a look at all of the AHP roles. AHPs provide system-wide care to assess, treat, diagnose and discharge patients across social care, housing, education and independent and voluntary sectors. Through adopting a holistic approach to healthcare, AHPs can help manage patients' care throughout the lifespan from birth to palliative care. Their focus is on prevention and improvement of health and well-being to maximise the potential for individuals to live full and active lives within their family circles, social networks, education, training and the workplace. So again, if you have any questions on those, please put them in the chat and we'll try and address them at the end of the webinar, or we can address them when we circulate the slides. So let's move on to the theme for today, which is around speech and language therapy. So what do you think of when you hear speech and language therapy? Perhaps you've had a personal experience. You may have received speech and language therapy yourself when you were a child growing up, or a family member may have seen a speech and language therapist. Sometimes it is this connection with the profession which motivates us to pursue a career in the field. Perhaps you've not had any personal experiences, but what springs to mind is thinking of children needing help with speech sounds or an adult with a stammer. And whilst these are part of our roles, the job of a speech and language therapist is much wider than this. We support people throughout the lifespan. We help people to communicate, speak clearer, and swallow more safely and comfortably. And today we have just a few examples from Amy, Chanel, and Naomi from areas they have experience of working in. Through their talks, we will show you what it's like to work with adults who've been admitted to hospital, who then subsequently are supported at home, and also with adults who are recovering and having rehabilitation after a stroke. We will also share an overview of what it's like to work with children or paediatrics. Katie is here to talk about how you may access a career in speech and language therapy through university. My career started working with children in schools. Now I lead a team of speech and language therapists working with adults, including people who have had a stroke or a brain injury, people who have long-term conditions such as Parkinson's disease, people who've had head and neck cancer, voice disorders, and adults with a learning disability. I've had the opportunity to teach abroad in Bangladesh and Uganda. I've published research. Other speech therapists work in the prison system with actors who develop nodules on their vocal cords affecting their voice, as just a few examples. There are lots of possibilities and variety. It is an exciting and stimulating career choice, and best of all, you get to see improvements in the people you work with that has real lasting impact. A patient with head and neck cancer once said, "A surgeon saved my life. Speech and language therapy gave me my life back." So we couldn't possibly cover all the areas of speech and language therapy today, so we're just giving you a flavour. Of On this slide, you'll have some additional links that will help you if you're interested in a career in speech and language therapy. The first link is a series of videos produced to showcase the role of speech and language therapists across different areas of work, including working with autism diagnosis, the forensic and youth justice system, working with assistive technology, and much more. So some of the videos are interviews, but also many of them show kind of the day in the life of speech therapists going into different areas of work. So they're really good to watch if you're interested. The second is a link to a brochure that we send out. It's a bit of an advert really for the service that I work in and lead. So it just gives you a flavour of what it might be like to work in a team, like for speech and language therapy. And the last link is the professional body that we belong to, which is called the Royal College of Speech and Language Therapists. Here you'll find lots of information about what we do and how you can become a speech and language therapist. So without further ado, I'll hand over to Chanel, who will tell us what it's like to work in a hospital.
Hi everyone, my name's Chanel and I work at Colchester Hospital on the acute wards. So we see patients who have been admitted to hospital and thereby their swallow or communication has been impacted or changed. My experience from working in a hospital is it is a busy, fast-paced environment, but also very rewarding at the same time. And by working in a hospital, we're able to work together with professionals like doctors, nurses, dietitians to support our patients. Patients and families have been so thankful for all of the work that we've done and the support that we provide for patients. And it's an amazing feeling to be part of an individual's life and to make decisions that can be life-changing for them. We see a variety of patients, for example, patients with Parkinson's disease, motor neuron disease, adults with learning disabilities, and therefore we speak closely with the patients and their family. Like I said earlier, working closely with doctors, nurses, dietitians, nutritional nurses, physiotherapists. We work alongside a lot of allied health professionals. We will also assess a patient's swallow with different food textures, and for assessing their communication, we will use objects, whiteboards, hand gestures, body language just to help support them with their communication. We will then provide swallow recommendations and communication strategies whilst they're in the hospital to ensure that they're eating and drinking safely and that they're able to communicate their wants and needs to their family, nursing staff. And then when the patient is ready to go home, we will let the GP know. And if they need any more input or support with their swallowing or communication, we'll let the community speech therapy team know. So that's what it's like working in an acute hospital for speech language therapy. But I'll now pass you over to Amy, who will talk about what it's like to work in the community speech therapy team.
Hi everyone, I'm Amy and I work in the community team. So I was just going to talk to you a little bit about what it's like to work in the community with adults, how we get referrals, what a typical community caseload looks like, and what it's like being introduced into community working as an SLT. So community speech and language therapy is quite different from acute or inpatient work. Rather than short episodes of care whilst they are an inpatient, the focus is often on long-term conditions, functional communication, supporting people with dysphagia, which is swallowing difficulties, and supporting people within the context of their everyday lives. So we get referrals, like Chanel said, from if a patient has been in hospital and they need further care, then we will get referrals from the hospital team. But we also get referrals from GPs, community nurses, mental health services and care homes. So our client group is very broad, but my team, we don't accept referrals for anybody who's on the learning disability register or that's had a stroke in the past 12 months, as they're specialised teams for them client groups. But our caseload may include people with progressive neurological conditions like Parkinson's or motor neuron disease, voice disorders, swallowing difficulties, or cognitive communication difficulties that relate to conditions such as dementia. So once a referral is received, we triage it and then we prioritise it based on the needs of the patient. So we'll look at reviewing the referral information, identifying any urgency and risk, and then deciding their priority level. So we've got an 18-week wait as a routine. However, we do have priority patients who we aim to see within like 2 to 4 weeks. But we also get referrals that we might need a little bit more information on because they might not be quite right for our service, and therefore we can signpost them onto a more suitable service. So Our caseload is very varied, and unlike acute settings, patients are usually seen over a longer period of time. So sometimes we have patients that might be on our caseload for years, especially patients, who might have motor neurone disease. We could have them on for a couple of years whilst their condition progresses. And when we are taking on new patients, we need to consider those patients that we do have for longer term to make sure that we have capacity. Intervention may take many forms. So we do direct therapy, we might introduce compensatory strategies, we might train carers or support staff, and we also support with environmental adaptations. We say that success in the community is often not measured by recovery, but by maintaining skills, maximising participation, and improving their quality of life. We work really closely with people's families, their carers, and other professionals such as occupational therapists, physiotherapists, psychologists, social workers, carers. And it's really important that we do work with them and that we keep our relationships, really good so that we can get as much information and support the patient the best we can. Documentation, outcome measures, and service targets are also a significant part of managing a caseload alongside the clinical work itself. So for many therapists, moving into the community can feel like a big transition. Compared to hospital settings, community working is more autonomous. So we have less immediate access to colleagues and medical support. And new speech and language therapists are typically introduced through a period of induction, which will include shadowing, joint visits, and structured supervision. Developing confidence in line working, risk management, and clinical decision is a massive part of this transition. So time management is another important adjustment. Community therapists need to plan their own schedules, factoring in travel time, missed appointments, and the unpredictability of working in people's homes or care settings. Once on a visit, a patient said to me that I don't always feel like you're my speech and language therapist, however, more of my therapist. Because when you attend, you don't know what you're necessarily walking into, and you could find a patient that is in crisis and they just need support from you. So you just have to be adaptable in your service. So community work, I think, is highly rewarding. We get to see clients within their own environment, which provides a deeper understanding of their communication needs and allows therapy to be practical, personalised, and meaningful. And now I'll hand over to Naomi from Stroke.
Hi everyone. So my name's Naomi. I'm also a speech and language therapist. So I work in a hospital and I work specifically on the stroke ward. So that's where people come when they've first had a stroke. So I've just put what is a stroke here in case you don't know. So a stroke is when the blood flow to part of the brain is interrupted, and that might be because there's a clot in one of the arteries or the veins, or it might be that there's been a bleed which has interrupted things, and this process can cause damage to the brain. So you might know someone who has had a stroke, and after a stroke, everyone is different. So people might just have small changes, or they might have very big changes, because everyone is different, and it depends on where the stroke has happened in the brain and on the person. But it's quite common to have both swallowing problems and communication problems after a stroke. So that's why often people will need a speech and language therapist after having a stroke. And after a stroke, for some people, these difficulties can improve. I've put here neuroplasticity. So that is the process where the brain is very clever and it can make new connections and learn new skills. So that is where we can come in because people can get better with their communication and their swallowing with some help. So as part of our role, we assess swallowing. So we look at swallowing, see what's happening. And there are some different ways we can do this. So I'll show you a couple of those on my next couple of slides. If I can have the next one, please. So one way we can look a bit closer at swallowing is something called a video fluoroscopy, which is basically an X-ray of swallowing. So we take them into the X-ray suite and we put them by the X-ray machine. We give people food and drink mixed with a special powder or liquid so we can see it on the screen and we can watch the food and drink go down. And that is really helpful because it can help us know what is going wrong with the swallowing, and it can help us know what food and drink might be safest and easiest for the person, and it helps us know how we can help as well. Because We can look at the food and drink, see where it's going, and we want to make sure it's going down the food pipe into the stomach and not down the airway into the lungs, because that can be really dangerous. So that's a really useful thing. And when we do this kind of X-ray, we also work with radiographers, who are another type of AHP that you might learn about. Then, if I can have the next slide, please. We also have another way to look at swallowing. So this is called FEES, and it's a camera type of test. So we put a camera in the nose and dangle it down into the top of the throat so we can see. So those pictures on the right, that is your throat. The hole in the middle is your airway that you can see. So we put the camera in, and then when the camera's in there, we can give someone something to eat and drink, and we can watch where it's going and watch what's happening. And you can't see the food pipe there because the top of the food pipe is usually closed, apart from when we're swallowing. So that's another way that we can look at swallowing. So we help people with their swallowing, help it be safer and easier. So next I'm going to talk a little bit about how we might be able to help. So on the left there, I've written some ways that we can help with swallowing. So often we can give advice around food and drink and what might be the safest and easiest things for people to eat and drink. Or we might be able to give advice about special cups or cutlery that might help eating and drinking too. We might suggest certain swallowing exercises if certain muscles are weak. So there's a little diagram there. One of the exercises sometimes we suggest is you put your tongue in between your teeth and bite down and then try to swallow. You can try it yourself, and that can help strengthen the back of the tongue because the tongue has to work a bit harder when you're biting down on it and pulling it forward. So we might be able to suggest exercises like that. We might also suggest some swallow maneuvers, and that's just some different ways you might position your body or your head, or different ways we can make swallowing a bit easier. There are also things we can do with electrical stimulation. So on the left, if you see that picture in the middle at the bottom with the pads under that person's chin, that's something we can do where we give electrical stimulation to those muscles that can help make them stronger. And then at the bottom left, there's a picture of a tube in someone's nose going down the throat. And they're special tubes that have electrodes on them and can give stimulation right inside directly to the throat, and that can help swallowing too, so we get involved with that as well, depending on the person and their swallowing problem. So on the right, we also want to help with communication. So after a stroke, people can have difficulties with their speech. It might be unclear speech, it might be slurred, it might be slow, it might be quiet, or they might have problems understanding words, they might have problems finding the words they want to say, they might say wrong words. So we want to help with that. So we can practice all these things with people, we can practice their speech, we can practice finding their words, and hopefully help them get better with those things. For some people, speech is always going to be a little bit hard, so sometimes we can help them find other ways to communicate. So I've put some pictures here. They might use gesture, they might be able to point to pictures, they might be able to use a kind of iPad with special apps that can help them communicate as well. So we can find those things to help people. And we also help the family and friends as well, help communicate with their loved ones. So that's after a stroke, the kind of things that we can do to help people. So next, I'm going to talk a little bit about working as a speech and language therapist with children, with paediatrics. So on the left there is a long list. So the children or young people we might work with might have autism, they might have different learning disabilities, they might have speech sound disorders, so that's when they struggle to maybe say certain sounds. They might have a cleft lip or a cleft palate. They might have trouble with hearing. They might have trouble with language, so saying the right words or the words in the right order. They might have a physical disability which impacts their communication or their swallowing. They might have mutism. They might have stammering or stuttering. They might have problems with their voice. And we also, some speech therapists see newborn babies because sometimes they have trouble swallowing and eating and drinking as well. So there are some specialist speech and language therapists who work in hospitals with newborn babies. So that means if you work with children, you might work in a school, you might work in a nursery, you might have a clinic where people come and see you, You might go into children's homes. You might work in a young offenders centre. As Katie said, we also work in the prison system to support people there, or you might work in a hospital. And as with lots of speech and language therapists, you often work in a team. So if you are a paediatric speech and language therapist, you might work closely with teachers, you'll work with the parents, with other specialists, teaching assistants, paediatricians, physios, etc. So we all work together for the good of the child. So you can see some of these pictures here. So again, we want to help with their swallowing and we want to help with their communication, and that will look different for each child. So at the top there, you've got a boy and he's using an eye gaze machine. So he has trouble speaking. So he's looking at the machine and he's able to look at what he wants to say and it will talk for him. So speech and language therapists might get involved in something like that. Or there's pictures that people use to communicate, or you've got a child there using sign language, so we can help with certain types of sign language. You've got someone there in a hospital with a baby, helping them be fed. And there's different ways we can help children communicate as well. So I really love my job. I've worked in different places. I've also worked in a school and now work in a hospital. I love it because every day is different. You never know what you're going to get, who you're going to meet. I really like working with people and helping them because if you think about it, communication and eating and drinking are really important things in our lives. So it's great to be able to help people with those things. And I like learning about the brain and about the body, which we get to do a lot when we're thinking about communication and swallowing. And I really like the teamwork. So you might work with the hospital staff or with teachers or with parents and families. And I like working together to try and help someone. So that's why I love it. So I'm now going to hand over to Katie, who's going to talk about different routes into the speech and language therapy profession.
Hi there, thanks so much, Naomi. My name is Katie Chad. I'm also a speech and language therapist, and I'm a lecturer at the University of Essex, where we have a number of different courses at the university that would enable someone to formally qualify and register as a speech and language therapist. So I'm just going to talk you through a few of those today. Thank you. So at Essex, we have 3 routes, and this is typically the same across the nation. So there are these sort of 3 program routes that you can enroll on to become a speech and language therapist. The first one is our undergraduate degree. So this is the kind of typical degree that you might go on to after school or after college. And that's a 3-year program where you cover all of the fundamentals and the essentials that you need to know to be able to go and practice as a speech and language therapist in the future. Similar to that, we have our postgraduate degree. Now that is a master's course, so that's typically done after someone has already completed an undergraduate degree, and that could be in a different kind of topic. So for example, one of a popular route into the master's course might be someone who's gone and done, let's say, a psychology degree straight after school or as an undergraduate degree, and then they've decided that they really enjoyed the language and the speech components of that degree, and then they enroll on the master's degree, which is slightly shorter. That's a 2-year program, but that still encompasses everything that anybody would need to then qualify and be able to register to practice. The other option that we have at the University of Essex is qualifying as a speech and language therapist through our degree apprenticeship route. Now that's an option for people who might go into employment in a related or sort of similar role to speech and language therapy, where the employer supports them to continue working, continue receiving their wages and their salary, but part-time go and train and come to the university and again get the qualifications for a license to practice. So for example, it might be people who have gone into a therapy assistant role, for example, and then maybe they start to think about actually maybe you want to go and qualify as a therapist, or teaching assistants, maybe specializing in speech and language, for example. I think on the next slide there might be a little bit more information. That's it, thank you. So with those courses, I've mentioned each of those. I did just want to point out, so at Essex, if you choose the undergraduate, so that's that very typical kind of post-school, post-college degree, we also have an option of extending that to 4 years, which can include a year abroad. So you can go off and work in a related field or go off on placement for a year. Some students go overseas and do some work and then come back and bring that experience into their studies as well. So we have a couple of different options for that undergraduate degree, but the actual academic side, you do the same sorts of modules, the same classes, but it's just whether it's spread across 3 years, 4 years. Like I said, with the master's program, it's 2 years. And then with our degree apprenticeship, we run what we call the 2+2 model, which is essentially 4 years in total, where you go and do an assistant practitioner sort of foundation course for the first 2 years, where you're in your workplace most of the time, but you're at university 1 day a week. That's for the first 2 years, and then the second 2 years, you are still in the workplace most of the time, but you're in university 2 days a week. So across that 4-year period, that's when you get all of your experience and educational qualifications as well. And obviously, with the apprenticeship, you're still getting paid whilst you train, which is a nice bonus. In terms of how you kind of learn to be a speech and language therapist, all of the degree programs, whether it's a master's or an undergraduate, are very diverse in terms of how you do that. So you will have lectures, so that's sort of, maybe a couple of hour class where you've kind of got the expert talking to you about different theories or the different ways of practice. But we also incorporate lots of different kind of types of learning. So there might be smaller sessions where you're in small group tutorials with just a couple of other students. We do things like role playing or simulation. So we've heard a bit already today about swallowing difficulties and how you might go about ascertaining if someone has a swallowing difficulty. We do a little bit of kind of practice on each other as students, and it's a real kind of opportunity where you learn all of that kind of theory, anatomy and physiology and that kind of thing, but really balanced out with that practical application and that ability to really have a go at learning things, trying things out in a sort of safe environment. And the main part of that then is what we call our practice placements, which is really that opportunity for students to go ahead out into the workplace and start putting those skills into practice. We can go to the next slide. Brilliant. Thank you. So just to wrap up a little bit more on the practice placements, it's the most exciting part of the course. Is really that opportunity where students find their feet as a therapist and can kind of develop those clinical competencies. So you're out in the workforce, you're with speech and language therapists, you're on the hospital wards, or you're in schools, or you're, working in the community, as we've heard all of those lovely examples of different ways speech and language therapists work. And you're really contributing then to that person's life, their speech and language therapy, and that service delivery. And students will come on the course and have a range of those experiences. So you will always get the opportunity to go and work in an adult population, and you will also always get an opportunity to go and work with children or in a paediatric population. So we make sure that you see everyone, and that forms part of the essential foundations that you have to do in order to get your qualification at the end. So there's lots of diversity in where students will get to go on their placement. So just quickly, in terms of Essex, there are a few kind of pull factors for Essex, as well as, of course, it's our lovely local region. But we have really good employment rates at Essex. So the School of Health and Social Care includes speech and language therapists. It also includes, for example, the nurses that we train, or the occupational therapists that we train. And as you can see, most of those people are already in employment or are studying more once they've graduated. We've recently been placed 12th in the Guardian University Guide and 29th in the Complete University Guide. And a lot of this is down to kind of investment that Essex have made in our practical facilities, and again that real emphasis that we place on that practical experience. And I think I've also mentioned our couple of unique programme offers where you can have that year abroad or sandwich year for the undergraduate in speech and language therapy as well. I think that might be all from me. I might be handing back to Kate, I think. Thank you.
Thanks, Katie. So this is actually the last slide, and it's just to say that you can find out about all our AHP careers in the webinar recordings that are available on the YouTube channel, which you can access via this QR code or via the link here. And I think that is about it for our presentation. So I'll stop sharing and we'll just see if there's any questions. Hopefully they're not too tricky. Is there any questions that we need to address?
There's no questions as yet, Kate, in the chat. So there's no questions at the moment in the chat.
Well, if anyone has any questions that they later would like to ask, then it's possible to get those through to us, isn't it? And then we can answer them, and the answers can come through with the slides, because we will be sharing the slides so that you've got all of the links, because many of the slides contained links for further information. So we can answer the questions then. So if you don't feel like asking it today, then there'll be an opportunity to do so, and we can address that afterwards. Was there anything else that we need to cover, Kay?
No, that's absolutely fine.
Nope.
As I say, no questions. What we will do to the schools that are still listening, as Kate said, we'll send that out. But if there's any burning desire questions today, you can always email them to us at Town for Care, and then we can send them off to the various speakers on the call today and mark them for them, and then they can reply directly to you. So if you have got any burning questions, as I say, put them through to Town for Care, and we'll make sure that Kate and the rest of the team get the questions and we can answer them for you.
Great. Thank you. And thanks everyone for listening. And I hope that that's inspired you into a career in speech and language therapy. I hope that you can hear that we all really enjoy our jobs and we're quite passionate advocates of our profession. But there's also lots of other allied health professional roles out there. So it's not just about doctors and nurses. There's lots of us around who are doing lots of interesting and engaging and stimulating things and really supporting people. So do have a look at those resources. Thank you. Thank you for your time, everyone. Bye.
Thank you. Bye all. Thank you.
Thank you.